So physiatry, otherwise known as physical medicine and rehabilitation, or PM&R, is a discipline within medicine that focuses on the patient as a whole and emphasizes function. I often say that we are musculoskeletal specialists, and what I mean by that is that we treat everything from the bones and the joints to the tendons and ligaments to the spine, including the vertebrae and the discs, and also the nerves that control all of those structures. Function is our focus. We've emphasized diagnosis and getting to the root of the patient's problem. So physiatry differs from other specialties in that we look at the patient as a whole. We don't ever make a diagnosis just based on one data point. For instance, it's very rare for us to treat a patient just based on imaging alone. We use multiple data points, including listening to the patient, hearing their story, hearing what their day-to-day life is like and where their pain comes from, what triggers it, what makes it better, when do they feel it, how is it affecting them. We also use our physical exam as a key point in the diagnostic process, and of course ancillary studies like imaging and electrodiagnostic tests and input from other specialists. And we use all of those tools to come up with the diagnosis and then allow us to discuss with the patient the best way to treat them. So a typical day for me here at Desert Spine and Sports is seeing patients, whether they're new patients or follow-up patients, in the clinic. I often start by listening to the patient, see how they've been doing, if it's someone I've known for a while, or if it's a new patient, I have them tell me their story, what brings them in. Then we sit down together and we go through their physical exam. I'll examine in detail the body as a whole, as well as specifically the body parts that are most troublesome to them, whether it's a hip or a knee, but we're always looking at the body as a whole, so that would include looking at the back, how the patient walks, how they get up from the chair and move from the exam table on and off. So the other part of my day I spend doing procedures for patients. In each of our clinics we have a procedure room. These procedures may include a variety of things, including epidural steroid injections, nerve ablations, ultrasound-guided musculoskeletal procedures, regenerative medicine such as PRP. I also spend part of my day doing other tests such as electrodiagnostic studies, which can help us identify the root cause of a patient's pain or dysfunction. And here at Desert Spine and Sports, we use a holistic approach and come up with an individualized treatment plan for every patient.